Hi guys, just a quick update. I've been out of the hospital since Monday. Everything has been good. I'm enjoying the company of Andrew and my mom. Andrew's taken a couple of days off to spend time with me. I post most of my little stories on Instagram and Facebook, so if you want to head over and check it out, you can always do that, just on the daily adventures. I've been swallowing well, so I'm thanking God for that. I'm trying to increase my intake for my food. But apart from this, I wanted to give you an update on my days in the hospital. So, although I'm really glad I'm not there anymore, I am so grateful for all the nurses at Warringal Private Hospital and the doctors that have helped me. They've nursed me, they've looked after me, not just physically, but also mentally and emotionally. They take me for walks, and they really care for me. And I'm so blessed. And I have the privilege to interview and give you a bit more of an insight to the life of a nurse. So I've got nurse Diana. I'll let her introduce herself, but she is an amazing angel that has helped me so much, and I'm so grateful. So I hope you enjoy a little bit of a insight into a nurse's life. Thanks. And I've got my first candidate. Do you want to introduce yourself?
Yes, my name is Diana. I work in Warringal. I'm an RN and I've been looking after parents for a few months now.
It has been. Diana's amazing. So what do you do mainly? What are some of your duties here?
I'm mainly an oncology nurse, so giving chemo, looking after oncology patients, but still look after medical patients as well.
And what's, would you say, the hardest thing or the most fulfilling thing that you've done in your profession?
Oh, the hardest thing is looking after the really sick oncology patients. It's just heartbreaking to see, when people are really vulnerable and really unwell, and there's only so much you can do. You want to do more, but we want to give more, but it's so hard. Some things are out of our control, and that makes it really hard.
And would be really rewarding as well, would you say, when you see them?
Yeah, when I see people getting better, or even just feeling in themselves better, not necessarily getting better, but feeling better, that's really rewarding.
Yeah, what would you say you enjoy the most?
I enjoy putting a smile on people's faces. I do. Just the little things, the little things that people think it's not a big deal. When someone rings the bell, like, could you please pass me this? I'm feeling so sick. Or can you do this for me? And, nothing's ever too big or too small. I just like to really, get out there and help.
And I just want to testify that Diana's just exactly the person she says she is. She's done so much for me. I'm so grateful. She's nursed me to health. From the moment I came in, I was in shambles. And Diana's just done everything for me. She even took me for a shower. I know, I'm getting teary myself, but I just wanted you guys to see how much these nurses do on a daily basis, and the shifts they take, they work, the long hours they do. Okay, so if I were to ask you another question.
I'll grab a tissue.
What would be the most misrepresented thing, would you say?
Among nurses?
Yeah. Or anything.
Thing. That's a hard one, because no one tells us. Maybe people grumble behind our backs when we, maybe say you have looking after a few people, and someone, maybe rings the bell and we're really running around. Sometimes we don't get there in their time they expect us to get there. Not that we don't want to, but just busy. So sometimes some people might think that we're just lazy or not doing what we're supposed to be doing, or don't care as much as we should. Maybe. I
Yeah,
don't
that
know.
that is true. That is true. Expectations.
Expectations, yes,
Yeah.
a whole lot of expectations, and sometimes it gets difficult when we can only do so much. As much as we try to do much more than we can do.
I wonder what can we do to help. I don't know. I don't know if people can help.
No, that's just.
I wish the government could do more for you guys.
I guess sometimes it's also expectations. I think with human beings, the government could do even so much more. They could still do. We could do a lot more. Maybe have more people. Maybe even nurse 1-to-1. But some human beings you can never really please. You can never meet their expectations. So that's the reality of it.
So I'd say be kind as much as possible.
As much as we can. Yes.
Yes.
Yeah.
And if you have a message to encourage the sick or the carers or people going through illness,
just keep going. Don't give up hope. Whatever it is that you're hoping, if it's God, keep praying, keep pushing, and I guess get help whenever you need it. At this time, in these times, it's really hard to do everything on your own. Just ask for help. Get some help.
That's true.
Yeah.
Thank you, Diana. Yeah, I'll take a selfie with you.
Thank you.
How do I do this video thing again? Say hi from a few nurses.
Hello.
What's your name?
Gerald.
And how are you helping me?
Yeah, I'm helping you go to your room.
Thank you, Gerard.
No worries.
So the gist of it is, thank you, nurses. We are so appreciative, especially if you're a frontline worker, for you to be involved, for you to turn up day in, day out, for you to do your long shifts, long hours, and with a heart that cares, and with a heart full of love. So please be kind to nurses. You guys are a special breed of human beings. And I hope that you all are very blessed with what you do and your daily, you find your purpose in life, and just how you manage your day and how you contribute to society. So here's a huge shout out to you guys at Warringo. Thank you from the bottom of my heart.